Alrighty, so what we're doing is an extended abdominoplasty. Do you see any bleeding?
No bleeding.
This is pretty incredible, right? Yellow, beautiful spot here at the Cosmetic Surgical Center of Cerrito. Thank you. Alrighty, so that's her belly button right there, and we're going down the midline, right? And notice the complete absence of bleeding. We went through a scar right there, right? That's a C-section scar, right? And this is the specimen. This is what we are to remove. But notice how we do this in a completely bloodless manner. There's a little blood vessel here, so what I do, and another one here, I electrocoagulate him, I burn him, so there is absolutely no bleeding when we go through this. See? This is incredible, incredible. So a little blood vessel here, we electrocoagulate him, and there is absolutely no bleeding. See? Now we're gonna go around the belly button, and she does have a hernia right there, so you gotta be careful with that. That's a belly ring right there, so we're gonna go around the belly button. We're gonna make the belly button a little larger than it really is, right? Especially since we have that hernia. And we're gonna go around that belly button. Then we're gonna remove the burn edge of the belly button, right? That's the way we do it. Thank you. What we're doing is we're removing this excess fat and excess skin. She does have a lot of intra-abdominal fat. That's fat that cannot be removed. That's fat that is inside where the intestines are. That fat cannot be removed with liposuction. It cannot be removed with atomic shock, which is what we're doing now. But we're gonna push it in when we do the rectus plication. Push it in, but she still will have it. I recommended that patients like these, when you have a lot of fat inside, you should go on the weight management program to lose that intra-abdominal fat. That fat is usually associated with diabetes, coronary artery disease, high blood pressure. So it's an investment on your life, really. Those weight management medications, they're incredible. We call it GLP-1 agonist, and it is available here. So the only time you should not have them is 1 or 2 weeks before the surgery. So she can start these weight loss medications in about a week or so after surgery. Thank you. Okay, so look at this. So this is the piece that we're removing on this patient, you know. She has severe intra-abdominal fat, so it's more difficult to get the stuff out because of the fat that she has inside.
Thank you.
So here is the right side of the specimen that we just took out. And
Wow.
this side, just yellow fat, no bleeding.
Beautiful.
What are we doing now?
We're making a new home for the belly
No
button.
home for the belly button is right. So what we're doing is de-epithelialization of this area, which is something that you do normally for breast lifts. So we did that on Friday, but it's not described in the abdominoplasty technique. I do it because I don't like bleeding, and when you go down to dermis, de-epithelialization means you take the epithelium out of the skin. The skin has many layers. One of them is this one. It's called the dermis. It's that white membrane. Usually it doesn't have any blood vessels. So I do it so that there is no bleeding. And now you're gonna see the yellow fat, right? And I'm gonna leave a rim of the dermis around to protect the surrounding skin from burning, because this instrument can burn, right? So I'm gonna go all the way down to see if I can find my finger here, right? There is a lot of tissue here, right? There we go. You can go inside. Yeah, right. Thank you. So this is your belly button right there. It looks like a little mushroom, and right on top here, this is a hernia. See, this is a piece of fat that belongs inside. The. You know, we're probably just gonna push it back in and close this hole. Thank you. Now this is the belly button right here. We're gonna cut the edge of the belly button and the rectus plication below the belly button and way above the belly button. All this. So she's not gonna be flat by any means. She has a lot of this intra-abdominal fat, but we pushed it in. We repaired the umbilical hernia, and we did a double rectus plication to restore her anatomy to pre-pregnancy state and push that intra-abdominal fat. But she still has it inside, but it's a lot better than what she was. She was a lot, and so better. Thank you. So we're done. Extended abdominoplasty, zero liposuction, beautiful belly button. Of course, she's gonna need weight loss injections, and she's gonna need liposuction. in 6 months, but she looks incredible. Thank you.